Nursing 474, the Nursing Center, a model for nursing practice in the community. The weekly learning objectives include choose a community health diagnosis for your community's problem, organize a plan for a community health wellness plan, choose appropriate goals from Healthy People 2020 for the community health care plan, collaborate with members of the community to diagnose, plan, and formulate goals for a community health wellness plan. What are nursing centers? A growing body of evidence documents that nursing centers improve health outcomes by increasing access to care, providing a more comprehensive approach to health and illness, decreasing racial, ethnic, and geographical disparities in health status, and holding the potential to reduce overall health costs. As defined by the American Nurses Association, nursing centers, sometimes referred to as nurse-managed health centers, nurse-managed health clinics, and nursing centers, are unique opportunities to improve the health status of individuals, families, and communities through direct access to nurses and nursing models of care, with decision-making and ultimate accountability for this model of care resting with the professional nurse. Nursing models of care. Nursing centers are strategically positioned to improve the health and well-being of vulnerable populations and build on the core values and beliefs of the profession, such as trust, health, caring, personal respect, equity, and social justice. Efforts focus on enhancing clients' capacity to meet their personal, family, and community responsibilities and interests, and typically include community-based, culturally competent care that is accessible, acceptable, and responsive to the populations being served. A holistic approach, interorganizational and interdisciplinary collaboration with multi-level interventions, community partnerships, and relationship-based practice. There are many types of nursing centers, and each has a personality of its own that reflects its missions, values, goals, strategies, and commitment to community well-being, collectively referred to as a service model. Additional factors that create a typology for nursing centers are organizational structure, federal tax status, and reimbursement systems. Wellness centers focus on health promotion, disease prevention, and disease management programs. They provide outreach and public health services, health education, immunization, family assessment and screening services, home visiting, and social support, such as enabling services like language translation, registration for entitlement programs, transportation vouchers, and specialty services. Special care centers. Some nursing centers focus on a particular group or are in those with special healthcare needs and are adjuncts to comprehensive primary healthcare models. Examples of special care populations include people with diabetes or HIV/AIDS, adolescent mothers, the frail, elderly, and people with cancer. Comprehensive primary healthcare centers. In addition to health and wellness programs, these centers serve as primary care medical home for both physical and behavioral health care services for individuals and families across the lifespan in the communities in which they are located. The nursing center team. Nursing center models support the skill development of advanced practice nurses, allied health professions, and support staff, and include members of the community at large as determined by the model type and services offered. The organizational framework may be dynamic and adapted to new community-focused initiatives. A fundamental premise at any nursing center is that the community in which the model is placed has the most power and influence on the model development and team composition. A center's success relates to how well the team works together to ensure the delivery of high-quality healthcare to target populations. In addition to the nurse executive, advanced nurse practice nurses, other staff, educators, researchers, students, there may be other members. Other members include community advocates or key stakeholders, board of directors or advisory board, and other organizational partners. A board of directors has oversight responsibilities, including fiscal management for the nursing center model. An advisory board guides the work of nursing center but holds no fiduciary or voting responsibilities. Organizational partners are value members and NMHC that develop and maintain organizational relationships will benefit through service agreements and contracts with one or more partners. Students are an asset to the nursing center model, and faculty bring skill sets that enable this nursing center to develop and implement programs that integrate faculty and student contributions and engage more of our target population. Research in nursing centers provides the opportunity to gain answers to questions and to share the findings with colleagues and public. Every nursing center needs a research agenda. As far as program evaluation, this is an essential organizational practice. The evaluation process is a systematic approach to improve and account for public health and primary care actions and is thoroughly integrated into routine program operations. Drives for community-focused strategies, allows for improvements to the program, and identifies the need for additional services. One resource is the internet-based courses offered through the Centers for Disease Control and Prevention's Public Health Training Network, the Community Toolbox. Positioning nursing centers for the future. The nursing profession is strategically placed to make significant contributions to the health of the people and achieve the Healthy People 2020 goals. Opportunities exist to advance this model. The public health system and the community models of primary care will be in the forefront of prevention, early intervention, and community-wide education. In addition to the everyday needs, catastrophic events can threaten our society's future. Nursing center staff will grapple with the complex health, social, and environmental issues presented by their clients and community at large. Nurses choose memberships in organizations based on interest, clinical and academic preparation, and employment. These organizations provide opportunities to unite professionally and share contributions. Legislators, healthcare systems, the nursing profession, and educational institutions, as well as the public, are now examining the interrelated factors that contribute to the decline in new nursing graduates, erratic surges in nursing employment, and the number of nurses who leave the profession. Health advocacy, focusing on health disparities and access to care for all, is an essential nursing role in nurse-managed health centers. Nurse-managed health centers have been identified as safety net providers, and because they represent a disruptive and innovative approach to the delivery of healthcare services, they have an ongoing need to address policy, funding, and political issues that either support or challenge their existence.